Yes, welcome to the show. That's Toto. Hold the line here on Light 87. You're hanging out with Blessie and Lloyd Thursday morning, the 2nd of April. So much great music coming up. But as we promised, we're talking to Dr. Razia Pendse, the Sri Lanka representative for the World Health Organization here in Sri Lanka. Thank you so much, Doctor, for being on the show with us. And look, there's so much for us to talk about. I know there's a lot of misinformation going about, a lot of myths to debunk as well, as a lot we still don't know about the virus. So let's dive straight into the questions. At number one, now we've got to talk about this. Now with the COVID-19, it is the latest in a series of coronaviruses that, alongside SARS and MERS, have plagued the world. It's not something new. Now research so far suggests that SARS and MERS have close association with animals. Now in terms of COVID-19, do we know or do we have any developments in understanding what the origins of the COVID-19 are?
So, as you have mentioned, this COVID-19, it's a new coronavirus. Now, coronavirus as a family of viruses, these are known to exist, and they cause illnesses in animals and more in humans, and they are largely zoonotic, meaning that they are transmitted between animals and people. And as you have mentioned, that we have had coronavirus diseases in the past, MERS-CoV and SARS are two examples. Now, this novel coronavirus that came in and later was then given the name of COVID-19, it is a new coronavirus. We are learning about this virus more and more. The first time that we heard about these pneumonias in China, that was reported to WHO was 31st of December. We had the genome sequence of this virus by 7th of January. And since then, our understanding of this virus has increased, but we are still learning as we are gathering more and more evidence on the virus. So it seems that there is an animal origin to the virus, but currently we do not know that what is the source of this COVID-19 and how it moved from the animal source to humans. But what we found is that we know that there is human transmission.
Right.
All right. So that is really interesting as we get to try and understand this virus. I don't know if we can, especially us lay people, but if the suspected relation to animals is true, do these viruses exist among animals already in the form of infections and diseases?
So generally, when we say that these viruses are there in animals, by and large, they do not cause death in animals.
Okay.
So they stay with the animals. And most of these coronaviruses, for example, they say that the primary carrier is a bat. So the bat has the virus, but it does not have the disease. It's only when this virus jumps from animals to humans that it causes disease in humans.
Interesting.
So they do not cause illness in animals. They are there in the animal source. When they jump from animals to humans, that they cause illnesses in humans.
Right. So, okay, that's interesting. Now, there's been a few cases that have emerged that the COVID-19 has been transmitted to domestic animals, including a cat, possibly dogs, we don't know. But we've been told that these are rare. These are isolated instances of the virus being passed on to the animals from humans. Does that mean that now these animals can transmit the virus, back to humans?
So the pet animals are not carriers of these viruses, and they are not transmitting the disease to the owners of these pet animals.
Okay. All right. So we've got successful methods to try and contain the spread of COVID-19, including social distancing. That's what we've been practicing. That's what everyone's talking about, among other measures. But do we have any advice from the experts on how to avoid and altogether avoid such coronavirus outbreaks in the future?
Now, what we are looking at for any infectious diseases, the pharmaceutical interventions, which largely are vaccines. And we know that infectious diseases, if you use vaccines, they are prevention measures. And this is primary prevention. So if you get a vaccine, you develop immunity and then you won't get disease. So in future, when we have a vaccine against the COVID-19 and all people are vaccinated against this virus, then we will not have future outbreaks, except for those who are not vaccinated, and there will be few cases.
Wow.
Example like measles. Measles is also a viral disease.
Right.
And in Sri Lanka, we have eliminated measles because there's a very potent vaccine available. It's given in children.
Right.
And then the immunity lasts a lifetime, and then you don't get measles, and that's how you're able to eliminate the disease.
Right.
There are many other examples, polio, for example, or diphtheria.
Yes.
So for prevention of future outbreaks, one of the pharmaceutical interventions would be a good vaccine.
Right. I mean, it goes
Can't avoid it.
Right. And, it's still quite baffling that, even things like polio, measles, these are viral infections, so dangerous that now we have a standard protocol of vaccines.
Absolutely.
So it goes to show how important that is. Now, Wuhan, among places, are lifting lockdowns and reporting drops in the number of infections, patients overall, with no proven vaccine still.
Right.
Even though eventually it's recommended that once it is available, that we all take it. And there's no medication available to treat patients suffering from the COVID-19. How do we make sure that there's not going to be a second wave of infections?
So important.
So the lockdowns, how they happen is to buy time. So that time has to be effectively utilized to then identify, test, isolate the cases that are positive, manage those cases, do the contact tracing for those positive cases, put those in quarantine. So both things have to go hand in hand.
Right.
If we only do lockdowns and do not identify, test, isolate, manage, do the contact tracing and the quarantine of the close contact.
Right.
When we open the lockdowns and people start meeting each other, then if there are cases, then we will have another wave of infections as we're talking about.
Right. And see, this is the question. This is why it's so important for us to heed the officials. But I'm also so curious, and I know a lot of people out there sent in questions, and they want to know why do the effects of the virus vary between different age groups? You have young people dying, you have old people dying, you have young people surviving, old people surviving. Why is that?
We break down with the age groups. It's not like anybody is immune to the virus. Anybody can get the disease. It depends on what the course of the disease would be. Yes, in China we found that children under the age of 10 are less likely. So the numbers were few. All age groups, the infection was there. But the course of the disease varies with age and with the underlying health status of the individual.
Right. So it doesn't quite, there's no concrete evidence about the age groups as yet. Just a few, I think, traits they've noticed. Interesting. Now, also talking about this, Doctor, can you tell us, is there anything in terms of diet climate, any of the myths that are going about? Does Sri Lanka have any advantages when it comes to dealing with the COVID-19?
This is the first pandemic in the age of social media. That is the difference between previous pandemics and this one. And there is a lot of, we call it in WHO infodemic. There's a lot of misinformation.
Right.
And because of social media, they get amplified very, very quickly. So one myth is that, for exactly said, that if it is hot and humid, then the new coronavirus, you have less chances of getting. But the fact is that this new coronavirus can be transmitted in areas with hot and humid climates.
Okay.
If you look at it now, the whole world has it.
Right.
There are very few territories and countries which have not reported a case.
Right.
So we've seen cases in all sorts of temperatures and levels of humidity. So the fact is, it can be transmitted even in hot and humid areas. And then all these things about, the local remedies.
Right.
I mean, these are good. Eating good food and maintaining your health is good because it helps you combat any disease.
Of course.
It improves coronavirus. But they are not treatments. They are not cures. There's a difference between eating healthy and eating it as a cure.
Right.
Well,
interesting.
Thank you so much. We know that you have a lot on your plate right now. We heard your phone going off in the middle of it. We so appreciate your time, Dr. Razia. But before we go, we would like for you to just share with us and to everybody listening in, what crucial advice would you have for Sri Lankans at this point in time where we are right now in the midst of our battle against the COVID-19?
Okay, my quick advice would be that what we need to fight the COVID-19 are facts and not fear. So please, people should empower themselves, go to the right website, get the right information.
Right.
Sri Lanka, we have the WHO Sri Lanka website, we have Promotion Bureau, the Vidyanshi Unit website, where all relevant information is there. Or you can go to our development, reliable sources, for example, CDC. Empower yourself with the right information so that have the facts with you. Don't fear the disease. and solidarity, not stigma. Because we've heard a lot of stigmatization of people with the disease, and that actually prevents people from coming out. And we know in Sri Lanka there have been cases where health workers have been compromised. We are all in this together. Together we will beat COVID-19. In passing, I would just like to emphasize, please people, wash your hands with soap and water. If not, use alcohol drops. Cover your sneeze and cough. Have your respiratory etiquette. Avoid crowded places. Maintain physical distancing. It is for betterment of all of us. Stay at home if you are sick, and if you have symptoms, reach out to your doctor. Thank you very much.
Thank you.
There you go.
That was great.
Wonderful time they're spending. Now, if you would like more information, here's that website, as Dr. Razia Pendse mentioned, for you to get more information straight from the source about the virus, what you can do, who.int/Sri Lanka, okay? And there's a link where you could learn more about COVID-19 and what you can do and all of the facts, just so that you can dispel any of those myths and rumors that you probably have been reading nonstop over the last couple of weeks over WhatsApp, okay?
There you go.
We're going to get into your news headlines.
Right, that's it. Stick around. We'll also be posting that conversation on social media soon in the course of the day. So watch that space if you missed it.